Hi, I'm Dr. Duffy and welcome to Tips for Seeing a Psychiatrist. This first video is entitled Getting Your Bearings in Psychiatric Treatment. If you're seeing a psychiatrist, this tips series of videos will help you by giving you supplemental information and support. The series deals with how to find a provider, getting your bearings in treatment, psychotropic medications, anxiety reduction techniques, unbearable feeling states and other things that are dangerous to overlook in treatment, and identifies common stumbling blocks in treatment. I've been the psychiatrist for Georgia College and State University for almost 14 years now. I work in the university's counseling center there. I created these videos because I wanted to provide my students more information and help than I can offer directly with a 4-session limit. My students are expected also to view another series of mine entitled How to Get Ready for College in Trying Times. There are parts of that series that might also interest you. You're welcome to view tips and link to the resources I will mention, and those I have listed on the GCSU website. But you need to understand that these do not constitute treatment, and you should read them with a critical mind and at your own risk. The general nature and brevity of these videos means that what is said does not fit every situation, and applying them to your situation may be risky. Medical knowledge is always changing. Please consult your own psychiatrist before implementing anything mentioned in these videos. They're not meant to represent Georgia College and State University. If you're one of my students, I expect you to view each of these tips for seeing a psychiatrist videos and do the homework that you will find described in the section of the Georgia College and State University website under Counseling Services, and then under Resources and Required Assignments from Dr. Duffy. You should be prepared to discuss them in our sessions. This first video is about getting your bearings. As one of my GCSU students, you would have already seen a therapist who referred you to me and had you complete a detailed questionnaire. I would have reviewed that and the therapist's notes. In your first session with me, you would likely have told me first about what brought you to treatment, what symptoms you are currently having, and what past treatment you had and how that went. In trying to understand the larger context for your problems, I would have asked you about your family, your past work and school experiences, your physical health history, and your past relationships and support system. I would have problem solved with you around how to conceptualize your difficulties, and we would have talked about the pros and cons of using medication. If we decided to use medication, we would have talked about which one made the most sense for you to take. All of this would have led to a working formulation of your problem and a working treatment plan. That treatment plan may include diagnostic lab work, genetic testing, or getting more collateral information with the permission that you give us, if realistic. A treatment plan or diagnosis is no better than the quality of the information on which it's based. It may be dangerous to withhold information, even though it might be natural to want to withhold it. This is especially true about information about suicidal threats. We may conclude that you don't need treatment, or you need different treatment than I can provide. We may find that you have a physical illness as the basis for your symptoms and refer you to a primary care physician. We may also refer you to an off-campus provider if we determine that you need hospitalization or treatment by a clinic or private psychiatrist that can provide more intense, immediate, and comprehensive treatment. We do this because we care about your safety. You likely would have left with a sense of having been interrogated, since I would have asked you many detailed questions as a way of ruling in and ruling out explanations for your difficulties. You will have noticed that I skipped around since I have already read your history, and it may have raised specific questions in my mind. In the process, we would have inadvertently focused on your weaknesses and not your strengths, possibly leaving you feeling a bit vulnerable. I would have been very active in the session, and you would be mostly answering questions, which is not a good precedent for what we need to do in the rest of the treatment, but necessary given the time constraints. Ideally, you would be taking a lead in the session, and I would be listening more and letting you talk about things that matter to you. Your sessions don't belong to me. They belong to you, just as responsibility for your life is yours and not mine. The usual medical model, likely familiar to you, might have involved your waiting passively to have your healthcare provider ask you about your symptoms, getting a pill that was by itself supposed to take care of your problems, and coming back only if you had additional problems or the multiple refills your doctor wrote had run out. This model reinforces the misconception that the doctor always knows best and the patient need only be the passive recipient of the magical pill. The treatment model used here and in many other centers requires your continuous active participation. It's a collaborative model that depends on your taking responsibility for your coming regularly to see both your counselor and your psychiatrist, for working with your psychiatrist in decision making about medications and treatment, for using effective contraception if you're on medication and sexually active, for reporting side effects, for telling your psychiatrist about self-destructive thoughts, and for updating your treatment team on changes in your life. Your continuous active participation in treatment is especially needed if your treatment involves taking medication. Medication affects each person differently because of differences in body weight, age, genetic differences in enzyme systems, comorbid illness, and other things. This means that your psychiatrist may need to make adjustments in dose or even change medications. Your psychiatrist needs you to be their partner in learning how your particular body handles medication and finding a medication that works for you. With your written permission, psychiatrists welcome input from your family, friends, and roommates. Keep asking your psychiatrist questions about the medication until you're satisfied and sure that you understand the side effects, the reasons they are choosing a certain medication over the other ones, all the options you have, the things to watch out for, and what they told you about how to take the medication. Be quick to report a rash that may have developed from taking medications like Lamictal. Be willing to avoid drinking alcohol when you take medications that lower the seizure threshold, like Wellbutrin and some other medications that are antidepressants. Be willing to taper off marijuana, which seriously blunts the effectiveness of antidepressants. Take your blood pressure from time to time when you're taking medications that may raise your blood pressure some, like the psychostimulants, Adderall, Ritalin, Vyvanse, and also Effexor and others. Keep your psychiatrist up to date on the medications you're taking from your family doctor that might interact. Let your psychiatrist know immediately if the psychostimulant medications you're taking for your ADHD and attention problems is causing irregular heartbeats, daily headaches, or paranoid thinking. If you're not one of my students, you may want to skip to the next video, since the remainder of this video is a discussion of items specific to students of our counseling center. I'll give you a second. At our counseling center, seeing me is not a standalone treatment. It's just one piece of your overall counseling treatment plan. I will not continue to see you unless you are regularly seeing your counselor. If you've missed sessions with your counselor, please let me know immediately so that I can talk to you about seeing another provider in your community instead of me. If you have to miss a session with me because you are physically ill, unexpectedly have to work, or have a nursing rotation that's too far away, or other things, then as soon as you know, call 478-445-5331 and reschedule. This allows me to give your time slot to another student waiting to be seen. The staff at the counseling center work as a team. That means that I, your therapist, and other members of your treatment team consult with each other as needed about your treatment. We all use a common electronic medical record. Being a responsible participant means collaborating with your treatment team and by telling them about any suicidal or violent thoughts that you have. When you return to see me, be prepared to talk about interim events, vegetative symptoms of depression like changes in sleep, anxiety level, appetite, energy, mood, or irritability. Bring up any information about the effects of medication and upcoming stressors. Take ownership of your treatment. I realize that all this information can make you feel overwhelmed and make you want to forget the whole thing and go back to what you were doing. Remember that you have come because you're dissatisfied with the way things are and have some vision of how they might be different. I hope that I can work together with you in your taking even more steps towards a positive change in your life. Thank you.